I would like to actually pick up on the thread of your talk where you spoke about, the overall development of Pakistan, of the IDSR framework in Pakistan, and how over time, how it was developed, how it has improved, and how we've adapted it to address different challenges that we face. One of the examples you mentioned is the recent, along with the COVID-19 pandemic, is the recent flooding of last year. There had been a lot of conversation last year. Ki jo floods aaye the, they were more devastating than past floods, and so was their impact, largely because of the effects of climate change, right? So I was hoping you could contextualize IDSR implementation in the reality of climate change. So because of climate change, disasters like this are going to happen. Obviously, infectious diseases का incidence भी बढ़ जाएगा, but also climate change की वजह से NCDs का भी incidence बढ़ता है. Non-communicable diseases also have been shown to really, the risk of those really increases with climate change. And so with this in mind, can you talk about how the IDSR framework might have to be expanded or adapted in Pakistan in order to address and non-communicable disease challenges in general, and maybe with the reality of climate change in mind?
Yes, Momina, thank you very much. Exactly, you're spot on the problem which we are suffering from. Let me share a good news, first of all, that IDSR already has the capacity to accommodate communicable, non-communicable, even mental health. So it's a broad-based strategy of responding to the diseases. By the way, till now, we are using IDSR only for infectious diseases. That is true. I mentioned about 33 priority diseases in Pakistan. They are mostly infectious diseases. The reason being, infectious diseases are, the nature is that they are sudden, they have the potential to become epidemic, so we are more concerned about that. So in IDSR, in the beginning, we are starting with the infectious disease. That is correct. But it doesn't mean system does not have the capacity. It's not like that. System does have the capacity. IDSR is a beautifully designed, updated system. It's a strategy which is, I already mentioned, it is already successfully achieving the results in most of the African countries, apart from the developed countries which adopted it way time earlier. So IDSR, number one, answer to your question, yes, it has the capacity. It can incorporate. Punjab is a province, first of its kind in Pakistan, who has shifted its IDSR on communicable diseases as well. They are reporting the data on DHIS2, which is the digital platform for IDSR. They are reporting the data on District Health Information System 2, DHIS2, for both communicable and non-communicable diseases. They have incorporated 60 plus diseases on which they are reporting the data. And the reason is that, the rationale is that it is a real-time data which is collected. So action is, again, can be generated in the real time. So it is fast, it is quick, it is actionable. So that is one thing regarding IDSR. You talked about environmental health and all that. Let me tell you another thing. We are following a concept. Again, it's a today's world concept, which is known as One Health concept. When we say One Health is a strategy, again, led by WHO and the international partners. It says that if you have to tackle the human health, you have to follow One Health strategy, which is comprised of a triangle, and that triangle has 3 angles. One angle is human health, other is environmental health, third is animal health. One Health strategy says that unless you cover all these 3 aspects which are interacting with each other, with one another simultaneously, you are not able to improve the human health. Let me be very clear over here. Ultimate aim is human health. We are all striving for improvement of human health. That is correct. But human health can never be improved unless we take into account simultaneously animal health as well as environmental health. When we do that, then yes, of course, you can dream of achieving a sustainable development goal, SDG 3 of health for all concept. But without that, you cannot do that. As far as IDSR is concerned, as I mentioned, it says that integrated disease surveillance and response. When I say integrated, it means to integrate with environment, to integrate with human, to integrate with animal health as well. We at this stage in Pakistan, we are in infancy stage of interacting and integrating with the environmental and animal health. But within human health, we are first striving because we do not have legislation so far. We are moving towards that as well. There are a lot of challenges why we are not there, because it is very easy to say you can interact, you can integrate with other sectors as well. But how you will do that? You do not have any legislative framework in your hand to do that. So I think that is the thing which needs to be done. But once that is done, system has the capacity. I'm telling you again and again, IDSR has the capacity to do that. It is beautifully designed. It can cater to all the needs which can come forward in our way. But once that is done, of course, things can be done. I hope it answers your question.